We envision a movement.
We envision a movement.
We envision a movement of God's people.
A movement of God's people.
God's people who choose daily.
Who choose daily to promote healing
in marginalized communities in the name of Jesus.
In the name of Jesus.
In the name of Jesus.
Yeah, so Grace, what a joy to visit with you today. I appreciate you inviting me into your home. It's a lovely home. It's a beautiful rainy day in the middle of the summer in
Grand Rapids,
Michigan, and you've got an incredible view. I imagine you sitting in here and having your quiet time.
Yep, you got it. You got it.
Yeah.
It's just a lovely spot, and God has blessed in amazing ways that I could never have thunk or imagined.
Yeah. Well, I appreciate you sharing your story with us today. I think it's an important story for a lot of different reasons. You were involved in some of the very earliest parts of the CCHF movement, maybe even, probably about the same time that CCHF got started.
A little later, but I knew when it got started was when I was in Africa, so I think. What year did it begin?
Well, it depends on who you talk to. I have papers that show it started in 1978, but the first conference was in 82.
Okay.
And there were a number of clinics that kind of got started in the late 70s and the early 80s, and including Cary Christian Center. And
I know one of the first conferences was held at Cary Christian Center.
I bet it was a small conference.
It was infamous, I'm told.
Yeah. Oh my goodness. So one of the first conferences, people flew into Cary International Airport. So
I don't know how they all got there, but a lot of them were located in Mississippi, so it wasn't very far.
Yeah. Well, so you've lived a life. You're a nurse, and you've lived a life, and you're not just a nurse. You're the champion of all nursing.
I'm the champion of missionary nursing.
You've spent time in Africa. You've spent time in Mississippi. You had a major role in Nurses Christian Fellowship for many, many years, for decades. You've sat on the board of CCHF. You actually were on the board while I was the CEO, and you came on shortly after I became the CEO. So you got to know me when I was stupider than I am now. But when I was new to everything, and in that you were a really big help. I always think of your role on the board as every time we had a discussion, you put your hand up and said, "What about nursing?"
You got it. So my role in life has been to make sure nursing is represented at the table whenever missions is being discussed. Yeah.
You've done all this with great faith and great faithfulness, and in many cases, a lot of courage. And you've done it as a single person, and I think that is amazing and a story that we need to hear.
Wow.
So,
begin at the beginning, or what?
Yeah, tell us first off, why did you decide to become a nurse?
When you're a little kid and they have the missionary things in church and stuff, I listened and I heard some missionary nurses, and I thought, yeah, God, that's really a thing to be caring for people in faraway places and representing you to those folks there. So I went into nursing thinking about missions. And of course, the school of nursing that I attended was affiliated with Wheaton College. So we had a great history of missions. And
what school was that?
It was West Suburban Hospital School of Nursing, and it was affiliated with Wheaton College. Wheaton taught the science classes and those kinds of things. And then it was a hospital school, a old diploma school.
Yeah.
And so it was more like an apprenticeship. We worked a lot in the hospital, during the day, and took classes and stuff like that. So, yeah, it was a good program. It was one of the leading programs. And because it was affiliated with Wheaton, I had an Illinois State scholarship that didn't apply to that. And so when I graduated from nursing school, my second love was the sciences and biology. So I decided that I would go to Wheaton College and get my degree in biology. So I did that. And then before I graduated from Wheaton, the director of the School of Nursing was on the phone and said the person who teaches the sciences with the Wheaton professors is going to be leaving to go to Australia. And I'm wondering if you would be interested in the science instructor position at the School of Nursing.
Oh, wow.
So I had that job lined up a year before I actually took it. And so I came back on faculty. Now I was young and stupid. I mean, this little 22-year-old person teaching student nurses.
I think that's a pre-qualification for serving Jesus.
I think so too. So anyway, and the other part of that position was, oh, by the way, Grace, you can be the faculty advisor to Nurses Christian Fellowship. So I got to be working with nursing students as part of Nurses Christian Fellowship. And it was just, I had prayed and asked God about how I could mentor nursing students, and that opened the door for that. And we had an incredible group of nursing students. And Heather Gammon-Cutillo was one of those people. That was
really? She was one of your...
She was my president, yeah.
Well, how about that? So she was kind of an early fruit of your discipleship.
Yeah, well, but she came from a good family as well, and so it was a wonderful blessing to do that. And I was young, and they looked at me and they saw somebody who was knowledgeable, who loved the Lord, who loved nursing, and my job was to get them through the sciences so that they could get their diplomas and take their boards. So, and I love teaching, so that worked out really well. I did that for 13 years.
Oh, wow.
And so the thing I loved about it was building into the lives of the students. And back in those days, Wheaton decided it did not want to have a nursing program, and we knew that our students were too well qualified not to get baccalaureate degrees. The profession was moving in that direction. And so I was part of the team who began the curriculum development for the new baccalaureate nursing program, did the feasibility study for that. Interestingly, we did the feasibility study, and one of the things that we learned was that we had more students coming to Oak Park, Illinois, West Suburban Hospital School of Nursing, than we had from Oak Park River Forest High School. They came from abroad.
Oh, wow.
Many of them came from, they were missionary kids. They came because of the Wheaton affiliation. They came from Kenya, from Philippines, and all those. So I had a lot of MK students and worked with a lot with them. And they had, unique, interesting perspectives. I've come to appreciate the third culture kids in new ways. So that was but as we were coming to develop the baccalaureate program, I realized that the focus was no longer on the student, it was on the profession. I said, oh God, when we get to heaven, we're not going to need nurses. We need to be building into people's lives, and nursing needs to be a way to build into people's lives. Yeah. And so I began searching and looking into what I thought God had called me to originally, to do missions. And long story short is I ended up going with my church, the Christian Reformed Church, and the Christian Reformed World Relief Committee to Uganda, East Africa, to work there.
And you went to beautiful Uganda on the equator, with gorgeous Uganda at maybe the worst time in Uganda's history.
Yeah, it was 1985. Idi Amin had just been overthrown. We were still in a civil war. The Amin factions were still trying to return, and the people who were overthrowing the southern people were not happy with the northern people,
Yeah.
and they were fighting. And so, yeah, it was the middle of the Civil War that I got to Uganda.
Where were you based in?
I was based in Arua. Arua is in the West Nile, so you've heard of the West Nile virus. That's where it comes from.
Right.
It's a little piece of the country that used to be part of the Congo, and had become part of Uganda. So I was first in Arua, and my job was to work with the Church of Uganda and a Ugandan nurse midwife to begin their community health development program as part of the church. So I worked for 3 years with a colleague named Margaret Ijoga, and during the war, we managed to begin a community-based healthcare program. It was a challenge, to say the very least. I was working, I actually got to Uganda partly because my big sister in nursing school was a missionary kid from Kenya, and she was working in Uganda, and she and I had hit it off, and I had visited her.
Mm-hmm.
And when CRWRC asked me, "Are you sure you want to, I mean, you know the situation in Uganda?" And I said, "Did you know that I was there last year visiting my friend?" And I had come home and said to my folks, I said, "I don't think I could live like that. There's no electricity, there's the war is going on and all this stuff. But, that was the one place that they had a need." And so she happened to be home. I took care of all of her finances, and she stayed with me when she was on home service. So I said to her, "Now, Anne, what do you think about my coming to Uganda?" She said, "Really?" I mean, she was so excited. I said, "Well, they're talking about a place called Arua." She said, "Oh, my aunt worked up there. She translated the Bible." And she said, "It's a beautiful place and we could work together." And I mean, she had this whole thing going, and I just was, "Okay, God, I guess you mean that I'm supposed to go to Uganda." So yeah, it was a wonderful, wonderful time, and a challenging to leave the nursing school. People don't always understand. I have been being groomed to become the next director of the
Right.
School of Nursing.
Yeah.
I had just finished my master's degree, and they were talking get a PhD, and I thought, people said, why are you going to Uganda? I mean, why are you leaving
Yeah.
you have a wonderful career here. You're a good teacher. You could do so many things, and you can make a lot of money.
Yeah. For people that are younger than we are, Uganda in the early and mid '80s was like Sudan is today. It was just,
We were on the Sudan border, so
and it was the most unstable
Yeah.
place, and horrible things were happening there, and it was one of the ground zero places almost for HIV.
Yeah. Well, when I got there, I didn't know. I had heard about HIV back in the States because I taught microbiology, and I understood that there was some new virus that was out, and it was infecting, hemophiliacs and people who were
Right.
homosexual, and so I kind of knew about it, but I didn't know that it was there. And then my colleague Margaret Ijoga we didn't have a telephone. This is before internet and communication. So the way things were communicated in Uganda was via Radio Uganda.
Right.
They read the notices on the radio.
Mhm.
And they read them in the appropriate languages, because there's 45 languages in Uganda. And so the Lugbara language came on, and she had word that her cousin brother was very sick, and he was not doing well. And then she got word, and it said that he had died, and she should prepare to meet the plane, that his body was coming up. It turns out he was in the foreign ministry, and he had died of what she thought was typhoid.
Yeah.
And I said, well, typhoid's treatable. Well, he's not getting better. And so that first funeral I went to was Margaret Ijoga's cousin brother, and then it turned out that that was AIDS, and from there it was downhill.
Yeah.
Because
I can't imagine
everybody
what it must
was
be.
dying.
Yeah.
Everybody was dying. There were whole villages where there was nobody between the ages of 18 and 35.
Yeah.
And the war was still going on. We were losing people, and then people were dying of AIDS, and so everybody. How do you cope? How do you deal with all that? So yeah, but God was present, and one of the Southern Baptist missionaries was Dr. Rick Goodgame, and he worked with, interestingly, a Irish Catholic Franciscan nun who was spirit-filled. And together they wrote a little booklet called God's Word in Medical Science Gives Answers to Questions Related to AIDS.
Wow.
And that little booklet was published in 12 different languages, most of the more common ones. And it was disseminated through the churches. This is all still while the war was going on.
Well, yeah, I was going to say, again, people don't really understand that during that time with the Civil War, radio waves could cross the boundaries, but the boundaries changed every week, and you couldn't get supplies, you couldn't safely travel, like none of that.
Yeah, we had radio call at certain times, and that's how we would communicate with each other. But yeah, they managed this little booklet, and Rick, that was about 3 years into my term, and I was going on home leave, and I went home and came back, and Rick was thinking of changing. He was thinking of going to Sudan instead.
Because it was nicer.
Who knows? It was one of those things. But I took his place ended up taking his place on the Patient Care and Ethics Subcommittee of the National Control Program for AIDS.
Wow.
So that got me, changed my whole career, because I had been involved, my focus in nursing had been women's health.
Mm-hmm.
It had been, promoting health for women and moms and babes. And it, suddenly I found myself in public health, because we had this massive pandemic that was, in our country.
Sure.
So yeah, different thing. But the interesting thing is that, historically in Uganda, both the Protestant and the Catholic churches worked together. We had the medical bureau that was, for Catholic medical bureau, Protestant medical bureau, and then the joint medical stores, and we just, there was too much work to be done. We didn't care, as long as Jesus was the focus of the work, and he was calling us to it. We were able to do that. So I could go on and on and on about Uganda, but there were so many wonderful, difficult lessons learned there.
So I would like for you to talk for just a minute, because I know community health has been a really, it's been one of the drums that you like to beat.
Yeah.
And I would imagine that a big part of that developed in your time in Uganda.
Absolutely. Yeah. There are so many diseases in Africa that could be prevented. And then the healthcare work, it doesn't mean that we don't need doctors and nurses and we don't need hospitals and clinics. It just means that they don't have to focus so much and regularly on the things that are treatable and preventable.
Right.
So working to try to prevent disease and working within communities and having communities own the health programming is so important, because there aren't that many people. I mean, as Margaret used to tell the story, children who live close to the hospital climb higher into the mango trees to get the mangoes than they do when they live far away from the hospital, because if they fall from the tree, there's nobody there to care for them. So it's just, if you have everything available, you don't work so hard to prevent it. But because there aren't things available, maybe you should think about preventing what we can and not deal with all those things. So one of the African ways of talking is in story. They tell these
Right.
little idiom things, and I love that one about her. She would get everybody in the village. Yes, Margaret, we really need to prevent these things. We can't wait that long for a clinic to get here. We need to do what we can. And so we would teach about, immunizations. We talk about water and sanitation and washing hands and keeping things clean and all of those basic things, and how to treat basic conditions, diarrhea with oral rehydration therapy, all those things that people could do for themselves early on. So I saw drastic, things change when people took ownership of their own health and could do things.
Yeah.
One of the things that in evaluating the program up in Arua, we had people come from the States to come visit us, and we had to take them around and show them what we were doing. And so we took them to a village, and my director said to the man of the house, and he said, "Now tell me, what did you notice that is different since the health worker has been coming to visit you?" He said, thought about it. "We haven't been to the clinic in 3 months." and it was just so revealing because he had implemented all the things we had recommended, and so they were staying healthy. And as a result, they weren't spending money on going to a clinic. They were able to send their children to school with those funds. So big changes in people's lives as a result of community development work. So I became sold on the idea.
When I started at CCHF, over 15 years ago, the community health was a luxury. It was seen as a luxury. It was something, wouldn't it be nice if we could afford, or if we had community health? But the focus almost everywhere, even though doctors understood that the issues were broader, but the focus has always been, or had always been up to that point, on patient encounters and curative medicine, what you do in the exam room. It really, praise God, but I think that we've turned a corner. I was on my way here this morning. I'm an early riser, and I got out of the hotel early, and I thought, what am I going to do until 10 o'clock? And
sorry.
No, that's okay. That's all right. I'm a morning person. And so there's a little clinic. It's a great clinic called Exalta Health here in Grand Rapids.
Heard of it,
And so I just thought, well, I bet you they probably, they'll probably start seeing patients about 8:30. I bet they have prayer at 8. I'll run by there and pray with them, and awesome. And so, and sure enough, I was able to, and when of course enough of them know me because they've been to the conference, and here's this odd-looking guy that doesn't look like he's one of the patients, kind of walking through their parking lot as they're coming into work. They're going, "What is that, Steve Noblett?"
What's he doing here?
So they usher me in, and they begin to introduce me around. And the first person they introduced me to was a community health worker.
Awesome.
And it was exciting to me because it allows. First off, it's a way to engage the community in your work. And then they've discipled their patients, just like I'm sure you did, to not only adopt and teach better health practices, but to do it in the context of the gospel. To do it as an expression of the kingdom of God. Absolutely. And what God is doing, and the hope that we have in Christ, and all of those kinds of things. And that's what they're doing now, and that's what's happening across CCHF. And it's,
it's been a long time coming in CCHF.
That's right.
I am. That is wonderful. That's so encouraging to me because I've been the champion for that as well.
You have,
and it hasn't always stuck.
That's right. That's right.
You got to repeat it sometimes to get it through
until it becomes somebody else's idea.
Exactly,
and that's okay.
That's the
all
beauty.
right.
That is the beauty of it, you know. When somebody else, I always knew I had succeeded when somebody repeated what I had said.
Like, hey, I got an idea. Let's do.
Exactly. And I thought, oh, you know, now I know that I have my work is done here because I have made my point. So
So here you were fruitful, deeply embedded in a rural Uganda at a really critical time. God opened doors for you to have a really broad and powerful influence on health decisions that were being made in that country on a national level at a super transitional time, and then you end up in the Mississippi Delta.
Yeah, well, the way that happened was kind of interesting. One of the programs in Uganda that I had worked with was a Luke Society program.
Yeah.
And so, Peter Bolins would come to visit that program. And because I was working with the Christian Reform World Relief Committee, and he had been in Korea with CRWRC and World Missions, he would call in and we would talk. At that time, I was assigned to work with the Uganda Protestant Medical Bureau. I was working in Kampala. And so, I had been thinking about the future a bit, and I had talked to CRWRC, and I had said that I had thought I needed to have a longer home service the next time I came home because we were only 3 months, and I was off talking, and I didn't really get to be with family as much as I wanted to be. And I said, if I could get like a 6-month term home service, that would be good. Well, long story short is they said no. And so then I said, well, maybe I then need to rethink about how long I'm in Uganda, because if I don't come home for a longer time, then I will lose I love Uganda. I did.
Yeah.
I loved Uganda, but you also have to think about what your return is going to be like and what you're going to do. And the skills I was developing in Uganda I didn't think were needed in America. Turns out not.
Joke's on you.
Joke's on me, yeah. Anyway, I mentioned to Pete that I was thinking about coming back home. And I said, do you know of any place that could use a nurse? And so CCHF had just published their little directory of all the clinics.
Oh, really? Yeah.
And it wasn't many, but there was probably about 30, 40 clinics. And he sent that to me. So I was paging through
Good
that.
for him. What a surprise.
Yeah.
He didn't redact 29 of them.
No. But as I was fasting and praying and asking God, what's my next move in life here, he was busy writing to me to ask me to come join him at Cary because Sonia Curlin was leaving and he needed a master's prepared nurse to do the work of a grant that he had gotten from Pediatric Society, or I forgot where it was, but it was a government grant but anyway, and it was doing, training the people in Cary to do the parent child program. And so, and like I said, it took a month to get a letter in Uganda. So I was fasting and praying. I got that letter a month later and realized that was the same time that I was fasting and praying. And
I'm reminded of the story in Daniel where Daniel's fasting and praying, and it's like 21 days later, the angel's like, hey, I've been held up. Like I heard you the first day. So maybe that angel was working for the post office.
It was Easter, so again, communication was difficult. So I ended up typing up a letter, and the Missionary Aviation Fellowship people had access to a fax, and I ended up faxing him a letter saying, I just received your thing, and yes, I would be willing to consider coming to Cary. And so that began but I needed to give notice to CRWRC because I was
Yeah.
breaking my contract and early, and I needed time to readjust to being back home in America. On a personal side, when I left for that term in Uganda, I had said goodbye to my dad. And I said, "Oh, Dad, it's only 2 years and I'll be back, you know." And he said, "But I won't be here."
Wow.
And that just didn't sound right. But he knew that something was going on. Long story short is if I hadn't come home, my dad ended up dying within the year that I came home. And I had come home a year early, so I would have been in Africa. And certainly being in Cary, Mississippi was a whole lot closer, 800 miles compared to 8,000 miles to get home. So God was using that all to get me home, to be here when that happened, and I could be with my mom. And yeah. So God has all of our days planned for us. We don't always understand why things are happening the way they are, but they do. They are all planned, and I'm always so grateful because I had 3 months at home with my dad. He was still working. He was only 64 when he died, but he was still working, and he would come home from work at 2 in the afternoon, and he would pull out a lawn chair, and we would sit out in the yard together and have a lemonade or something, and we would talk. And I had 3 beautiful months. And then I moved to Cary, and then he had a brain tumor, and then, he had surgery, and things went downhill, and he died in February. So
Wow.
it was that well planned. Yeah.
Yeah. God ties up loose ends sometimes.
Yeah. And, Cary was a good place to re-enter America. Boy, I mean, if it had been in Chicago, where all the hustle and bustle, Cary moves on a little different pace.
Sure.
And I was used to the African pace. I remember so many crazy things. You come back. People think going on overseas is hard. Coming back is even harder.
Yeah.
Because I would do stupid things like pull into the gas station and ask, "Do you have petrol?" and
it's not in a plastic bottle.
The rain was coming, and is it safe to go? Will the road be passable? Of course the road is passable,
It is rural Mississippi.
It is rural Mississippi, but
in the U.S.
But so those kinds of things, it was good to be in a place where people understood a little better, and it was a good orientation for me to come back.
Well,
So
good.
yeah.
So a lot of people have no idea where Cary, Mississippi is or anything about it, but you kind of give us a little flavor for the town and sort of the population that you guys were serving.
Well, Cary is up Highway 61, which is the Blues Highway. So
Right.
the Highway 61 runs between like
Memphis
and down to Baton Rouge or someplace down there. So it's on that road. I lived in Mississippi. The Luke Society was actually, in Vicksburg. The Luke Society was located in Vicksburg, and I lived in Vicksburg. I thought about moving to Cary or living up there, but Pete had other things for me to do.
That's about a 40-mile.
It's about 30. It's at 37 miles exactly.
37 miles,
up the road, and it's just a widening in the road. Really, there isn't much there. There's it changes, but it's just a little widening in the road. And the next big town is Rolling Fork, which is the county seat for 2 counties, Sharkey and Essequina counties. And
when you say big town,
it had a stoplight, I think.
A stoplight. There we go. Yeah. Maybe a couple of thousand, 2,000 or 3,000 people.
Yeah,
maybe I don't know. Maybe there's.
It's
8
on
or
Deer
10,
Creek, and it's cotton country, and the aerial applicator planes are flying low overhead, and doing all those kinds of things. And
So my understanding, Peter Bolins, who started ministry there. Wrote a little book when he was with the Luke Society called Delta Doctor.
Yeah, well, that was written actually when I was working with him.
Yeah.
Yeah. It was about his calling to come to Cary and the first days of Cary Christian Center. Pete had been a general practitioner, had gone out with World Missions and World Relief of the Christian Reformed Church to Korea, and had done work in Korea and came back to the States to do his pediatric residency and also get an MPH, Master's in Public Health. And he did that at the University of Minnesota. And while he was there, somebody challenged him and said, "Why are you going to Korea when there's poor people here in the United States?" And so Pete, in his academic way, studied what was the poorest part of the United States, and turned out it was Sharkey-Essequibo County
Yeah.
and Mississippi.
Well, at the time, Mississippi had the highest infant mortality rate of any state in the country, and Sharkey and Essequibo counties were the two counties with the highest infant mortality rates in Mississippi.
Yeah.
And they just sort of, he had this heart for pediatrics, and he's like a child born there had about as much chance of having a first birthday as a child born in almost any Central American country,
or Uganda,
or Uganda for that matter. Yeah.
So that was all taking place earlier before. But one of my nursing school classmates was one of his first nurses, and she became a nurse practitioner and practiced down there. Connie Solom McCulloch is her name.
Yeah.
And so when we had our class reunions, Connie was talking to me about this place down in Cary.
Yeah.
That was there. And then, of course, when Pete came to Uganda, I knew that Connie was down there in Cary with him. So we had those kind of, connections, which is always interesting to see how that works. So he came, and he had this MPH, and of course, Mississippi didn't have a whole lot of resources, so he actually became the public health officer down there as well, and he worked out of the charity hospital in Vicksburg, and started this clinic. He had a clinic all ready to go, and a big tornado came through and wiped it out.
Wow.
And then they had to start over, and they ended up in the school that was empty there, and redid that whole thing as Cary Christian Center.
Another one came through a year or two ago in
in
Rolling Fork.
I went to visit my friends after that happened, and I didn't recognize Rolling Fork. Yeah. It was just amazing.
Yeah.
It just tornadoes down there, and what can you say?
Yeah.
It's the territory. So, and they have a lot of flooding too, because they're on the Mississippi River.
They're in the Delta. There's a reason it's called the Delta.
That's the reason why it's called the Delta. So the folks down there, as we used to say, if there's anybody who had any get up and go, they got up and went, and the folks that were living there were the people who didn't have the resources to do that. So they were incredibly poor. I remember I did WIC certification in the clinic for a while when I first got there, and I had to. Mom had just had a new baby, and I couldn't get to the clinic, and they needed formula for the baby, and so I went to the home to visit, and had no running water
In the United States.
in Cary, Mississippi. And how can you make baby formula? You can't make baby formula with water that you don't have clean.
Yeah.
So then I had to go back, and I had to get, certified that they deserve to have ready-made formula, because I didn't want that baby getting sick from using water that...
People have a hard time understanding that on many Native American reservations.
Same situation.
Same situation today.
Yeah.
In this century.
I know.
It's crazy, and that's not something. That was a surprise to you.
Well, it wasn't. I had come from Uganda. I knew.
Yeah.
We had.
You knew
dealt
what to
with that.
do.
But the thing was that yes, I was back in America.
Right.
And then what Pete had asked me to do was, this is the beginning of Bill Clinton. This was in 1991. And he was going to, they were going to reform healthcare in America.
Right.
And Hillary was going to do that. And so he said to me, I want you to help figure out what the Luke Society should do in terms of this healthcare reform. And so, put my thinking cap back on, and I realized that, again, if we had what they were talking about in terms of healthcare reform was curative healthcare reform. It was
Right.
not the whole community health thing, and there was no health promotion. And certainly we were still in the era of separation of church and state. We didn't have anything happening together. So, I said to Pete, what we really need to do is focus on helping churches and Christians and people called of God to promote health and the gospel of Jesus in their own communities. And he agreed that's what we would do. So for the next, how many years, 7.5 years that I worked at the Luke Society in Vicksburg, that was my role. I did not work at the Cary Christian Center clinic. I was working with other people trying to help them get programs like that started. And we had about 13 programs across the states that I worked with. Some of them were successful, some not. But
Have you kept up with Cary Christian Center over the years?
I served on their board after I left for 6.5 years. And then I have my friends, Care Newhoff and Dorsey
Right.
Johnson and my friends down there. So I try to keep in touch. I don't know currently what the status is. There were some decisions made that I wasn't real happy about. When they fired Care and Dorsey, that was not a good move. And so I helped them through. I helped Care and Dorsey through that hard time.
Yeah.
Steve, you and I have had conversations about, boards and
Right.
and having good orientation for boards and what their role is and what their role is not. And it was, even being on the Cary board was a difficult thing because,
Sure.
if you don't understand community development, and half the board, most of the board did not. There may be 2 or 3 of us that did.
Yeah.
So, things like that happen. And we've seen it happen many times in CCHF organizations where, boards make decisions that you wonder, really, what are you thinking?
Yeah.
But anyway.
I was talking to our friend Dave Bosher yesterday about boards because he had served on the CCHF board, and he had some similar experiences where he had been too, and and I shared with him. I said the great news is CCHF has a great board. I think we have maybe the best board of any of the boards that I know of in terms of commitment, engagement, functionality, mission faithfulness, all of those things that are really important. You were part of that, and I appreciate that because you were part of the.
I was championing nursing, don't you know?
That's okay. You understood your role, and I think that's. I've said this many times, but it was shared with me by our friend Bruce Miller, who was on the board when you were.
Yeah.
That it's the job of the board, in a bowling analogy, to set up the pins and then to give the CEO the ball and tell him knock the pins down. It's not their job to tell him to bowl right-handed or left-handed, or it is their job to tell him to stay out of the gutter and tell him what the gutter is. The gutter has to do with values, and it has to do with certain policies.
Sure.
But operationally, they need to stay out of it, and they need to be really clear that it's their job to guard the mission.
Yeah.
And you do that. You set the pins up by developing a mission statement and then strategic plans that are aligned with the mission statement. So you were a big part of helping our boards with CCHF
when we were beginning that. I remember talking about what is the mission of CCHF and what are our values and how are we going to pull that together. And
when you were on the board, we spent 1.5 years talking about the mission statement of CCHF, and we didn't change it.
I know.
But we examined every single word, and I remember At the time, it was, and we have changed it since, barely. But the mission of CCHF was to educate, equip, and encourage Christians to live out the gospel through healthcare among the poor. And I remember words that were really important to us was, first off, we're not an evangelistic organization. We're a missions organization that's targeting Christians to get them to engage in mission medically. But the word among, I remember we talked about that for 6 months.
Yeah, we did.
And since then, let me tell you what's changed.
Yeah.
What's changed is we don't use the phrase the poor anymore because it can be dehumanizing.
Yeah.
We talk about among people experiencing poverty. That's the only change that we've made to this to the mission statement.
Praise
in all
God.
these years. but like we took it serious.
Yeah.
But when we finished that process, everyone on the board owned that mission.
Yeah. And we wanted everybody to know that was, I mean, anybody who got affiliated with CCHF had to also know that was the mission.
That's right. That's right. So the story of Cary Christian Center, I don't know. Honestly, I'm out of touch with them in the last few years, but they stopped doing medicine. Like
they did that when I was on the board, actually.
Yeah, and became entirely a community health organization. I think they had some did some dentistry and things like that.
But that's gone by the way as well. All the curative stuff is pretty much gone. Because we had the parent-child program, and I worked with it, working with our community health visitors, the people. We had 3 women who we had trained from the community to visit all the prenatal moms and then keep going, visiting them until their children went to Project Head Start, when they started Head Start. And I remember that was the grant that we had, and I had to report to the grantors what the progress. And so one of the things I had to do was I called the state of Mississippi to find out what our goal was to reduce infant mortality, right? So I asked them for the statistics for Sharkey-Essequibo counties, and Mississippi, of course, they had white and non-white stats.
Right.
So,
yeah.
She looked up the stats for me, and she said, "Wait a minute, this can't be right." I said, "What?" She said, "Well, the non-white is lower than the white." And
that was the focus of y'all's.
And that was well, there was nothing else going on.
Yeah.
The health department had closed.
Yeah.
We didn't have a health department in Sharkey-Essequibo County. The only thing happening in Sharkey and Essequibo County was Cary Christian Center and their programming.
Yeah.
So we actually reduced infant mortality. Now, statistically, it's questionable. I mean, there aren't that many babies born, and we have all those kinds of things. But when you compared it to another county, a similar county, it was much lower than what that comparison was. And so, to have that kind of data to say that this kind of outreach program makes a huge difference in the lives of the people.
It does. It makes a massive difference. And actually, those 2 counties became. So it was reported on, I think, CBS News at one time, wasn't it? The CBS did a story about that.
It was talking about what can give us hope in this whole process, and Cary was one of the programs.
That's right, and it was run entirely by community health workers at the time.
Yeah.
That you guys set up and you started the training for, and that kind of thing, and that those 2 counties went from being the worst counties for infant mortality in the worst state in the country to being in the top 5% of having good data, good outcomes.
Decent data.
Not just the data, but the infant mortality rates were really, really great.
Yeah.
Comparatively speaking.
And babes and kids and things were doing better in school. And I mean, there's just a whole lot of things that come out of that, and not just the data, but you know, just the impact that it has. If you go across the river into Louisiana, which I did once, to Tallulah, I mean, the contrast between Cary and Rolling Fork and Tallulah, Louisiana, just incredible. I mean, all you had to do is just look and see the living conditions of people and how things were. It's just amazing.
Well, and you know, to make this beautiful story into a commercial for a minute, you know, like seriously, there are pockets like that all over the United States today.
Yeah.
In Mississippi, in Louisiana, in Arkansas, across the South, across the Southwest, in rural areas all over the United States, in Eastern Kentucky. I mean, there's some amazing things being done, and there's so much more to do.
Yeah.
It's still a great mission field, and in terms of need and in terms of spiritual need as well.
Well, and I think, you know, my other plug is that I think this is where the role of the church comes in, because I don't think there's a lot of programs that have been started and they pay their health workers. Now, we'd stipend our health workers because they were driving long distances and they needed to have some reimbursement for their costs. But, you know, if you expect to have a whole program, then the sustainability issue becomes a big issue. How do you find money to continue this kind of level of care for people, even if it's done by local people, lay health people? Yes, you know, one of the criticisms that I have always received is that you're exploiting the poor because you're using them and you're not paying them. They deserve to be paid. And I don't know how to get around that, you know. We're
talking about community health workers using neighbors as community health workers.
Exactly. I mean, they care about their communities and they want to do. I mean, if I can find a way to give them some reimbursement, I will. I mean, it's not that I'm against paying them. It's just that to have a program that's sustainable. What's the most sustainable thing that we have? In Africa, it was the church. And we had people in the church. Well, I worked with churches at the Luke Society that began all sorts of different kinds of health programs that were very successful. We had one in Jacksonville, Florida, that was sort of a mom-to-mom program, and the women in the church, you know, took on teenage moms who didn't know how to parent, and they built into their lives, they mentored them, and they presented the gospel to them too. Thank you very much, you know. And then many of them decided, oh, maybe I should get married to the person that's fathering this baby, and you know, all sorts of things come as a result of that. But you have to have people, and I think the church needs to recognize that they have a role in health. You know, now I've been involved for a good number of years, another little plug for Health for All Nations, but you know, we're really working to try to get the church to understand its role in healthcare, because it has passed that on to non-religious people. We used to have hospitals that were Presbyterian hospitals, Baptist hospitals, Catholic hospitals. You look at the names of those hospitals now, what do we have? Corewell Health.
Yeah.
You know? Really. In Chicago, Rush Presbyterian St. Luke's, just Rush.
Yeah.
We don't have to go there, but anyway, that's another little bandwagon I'm on.
Right. And it's in many cases, the toothpaste is out of the tube. It's going to be hard to get it back in. But nonetheless, you know, I think a good wrap up for this would be, I mean, just talk for a minute about kind of like you've had a phenomenal history in missional medicine as a nurse. You've seen it in the weeds. You've seen it, you know, as a engaged in an organization like CCHF, Nurses Christian Fellowship, now Health for All Nations. All of those, that gives you a broader perspective on things.
I think one of the things when I was beginning, somebody asked me, what's important to you when you're working in missions? And I said, one of the things that's very important is that we recognize that every person is created in God's image. and they deserve to have whole person kind of health.
Yeah.
God cares about them, not just their souls. He cares about their bodies.
That's right.
And so we need to go back to that. And I think as healthcare professionals, we have a calling not to just care for people's bodies, but we have a calling to care for their souls as well, and their families and their communities too, you know. But it's something that it's kind of lost in the whole healthcare delivery program that we have in the United States. And I'm hearing that so much from nurses. I'm hearing it from my physician friends. I'm done. I just can't manage to do this. But we have a calling that's higher than whoever we're working for. It's the calling that comes from God to care for people holistically and provide for their health and their spiritual care needs. If we listen to people carefully, we will hear their spiritual heart, and we can meet that need. And it isn't that we have I remember Pete telling me that he wanted me to write a curriculum to teach people health workers how to evangelize. And I said I would not write that curriculum. I said, it's not about evangelization. It's about meeting people's spiritual needs. It's about listening to what their need is and then finding a way to introduce them to Jesus, who can meet those needs in ways that we cannot. And I wish the church could see that as well.
So I think as members of the body of Christ who have been called into medicine, we should carry in an appropriate, respectful, responsible way, we should carry the treasure that is hidden in us by the Holy Spirit into the work that we're doing and share that with our patients. But and to do it out of love, not out of notches on belts and how many people did you pray for today and that kind of thing, but to do it in a way, like you said, that it addresses spiritual needs. Patients understand they have them, and there's so many studies out there that show that patients get it. They understand that their spiritual health is as important and connected to their physical health, and that studies, many surveys and studies show that the vast majority of patients would actually like their healthcare provider to address their spiritual needs.
Okay, I'm going to go on my little nursing plug.
Okay, go. Yeah.
Because David Larson was one of the people who began to understand that, and he was down at Duke or someplace down there.
Yeah.
Unfortunately, he died early, but he learned that from my colleague, Judy Shelley, in Nursing Christian Fellowship. When I met him at one time, he said, if it wasn't for Nurses Christian Fellowship, I would not have ever taken this path. Yeah. Because nursing has always been called of God to care for the poor, not necessarily, to care for the sick, dying, and injured is really the way we put it. But again, the church is also a member of the community, and the community has spiritual needs as well. Yeah. And we're not meeting those either, Well,
and I think one of the things, not only do we have a responsibility, I think, to be holistic in our approach towards our patients, but I think that we have a unique opportunity to help the church reconnect. We're in a day now. This is in this post-COVID crisis age that we're in. We're watching the church in the United States shrink rapidly, and it's because we're trying to rebuild what was lost, and we're in new wineskin territory. Yeah. And part of that new wineskin can and should include caring for people in physical ways, not just spiritually. And so, I would love to, I'd kind of like to make a plug that, healthcare professionals should line up at their pastor's door and just say, whether you put me on staff or not, I think you ought to consider me part of the staff here. And I think, whether it's parish nursing, which is a big thing, and
that's
still a
another-
very, very
still
effective
very,
thing.
very effective. Yeah.
Or whether it's starting a clinic, or whether it's doing community health outreach, all of those things I think can be an extension of the gospel, certainly an expression of Christ's love and concern for our vulnerable neighbors.
Yeah, I think that's the key, is that we have to be lovingly caring about our neighbors. And there, when I listen to the prayer request in a church, what are most of them for?
Oh, yeah, that's right. It's all health.
It's all mostly health.
Yeah.
And yes, we pray for, the doctors and the nurses and whatever to care for this person. No, what about the church caring for this person?
That's right.
And their family members who are caring for them?
Yeah.
It goes on.
And honestly, the church caring for the caregivers too.
Yeah,
Like the church, it grieves me so many times when I see people who, like you, have lived a missional life, as a nurse working in the United States, or as a doctor working in, a nonprofit clinic or a community health center or a free clinic, whatever. And when I ask them, how does your pastor think of you? How does your church think of you? Well, they have a missions board and they've got pictures of all the missionaries that they've sent overseas.
Yep.
But they wouldn't ever consider
the
the
local
you guys,
person
doing missions work, which you are. And we just need to help. I'm not a former nurse, but I am a former pastor. Like, I needed help. I needed help understanding that. And I regret that I didn't understand it at the time.
Yeah. Well, I look and I see great progress in some of these areas. I mean, it seems it's easy to get disparaging, I remember in the early days of CCHF, I was quite disparaged because I asked at one of the conferences, what does Christian healthcare look like? And the answer to that question was that we give excellent healthcare.
Yeah, that's just what healthcare is supposed to look like.
And no, that was their answer to how it was Christian, was because it's excellent.
Yeah, that's
and all I'm saying is that CCHF has come a long way from those days when we thought as doctors and nurses all we had to do was provide good health care. And so I'm encouraged. I'm encouraged by the young people who are coming up who see this as God's calling on their lives, who are willing to sacrifice, what others are thinking as their careers and what they should be doing, and saying, no, I'm not going down that path. I will take a easier path, not an easier, but a less economically rewarding path for serving God. God has not called me to make a whole lot of money. God's called me to serve and using my skills. So, yeah.
Well, I think you stand as a great model for not just for women and not just for nurses, but for all healthcare professionals that are is eager to follow Christ and who see their call who see their medical and healthcare education as a tool that helps them do that, not as an end unto itself. I think you've been fantastic at that. And Grace, I just want to thank you for the time that you've shared. I want to thank you for the faithfulness that has been the mark of your life to all of us, and for sharing that with us.
Appreciate you saying that.